With organizational meetings out of the way, Caribbean Association of Pharmacists President Dr. Marvin Smith is looking forward to a healthy discussion of various topics in the realm of pharmacy, looking at health and wellness.
We have a workshop on HIV management and some of the new therapies there. We have talks on chronic diseases, diabetes. We have talks on how to interview well and how to interview patients and get counseling information. And we also have a talk and a lecture and our journal article on the evolution and the evolving scene that involves the research and development of cannabis for medicinal use. So our thing is this: we want to make sure that we're covering all sorts of topics across the scope of pharmacy, community pharmacy, hospital pharmacy, the retailers and the wholesalers, the regulators like myself, the educators, and this is important as the University of Belize begins their bachelor's program here. We're so proud of what they're doing here, and we applaud the government for putting the money into that. So we're going to talk about all of those different types of things. It's going to be a wonderful conference this week.
According to Dr. Smith, the relationship with your pharmacist does not end when he hands you the pill bottle or other medication. In fact, to defeat the high level of non-communicable disease and foster health and wellness in our populations, pharmacists have become advisors to their patients.
Today's pharmacist is trained to do so much more than dispensing. Cholesterol testing, blood sugar testing, blood pressure testing, evaluating natural and conventional medication therapies. And so this concept of wellness doesn't just stop if you're not dispensing an actual prescription. Simple things like products we use for hygiene and those sort of things every day. These are critical for us. When the pharmacist becomes that central point of knowledge for the patient, they will become a valued member of that patient's healthcare cycle, all right? And the economic benefits will flow. We know, all right, from research and from our own experience within the field, that when we treat our patients right, even if we don't sell them, if we say to them, you don't really need that medication, or you don't really need that over-the-counter stuff because you don't have that, or that's not going to work for you, that patients appreciate that. And the next time they need something, they're coming back to you. So you're building a long-term relationship.
And the president of Belize's Pharmacy Association, Beverly Coleman, contends that pharmacists must take that relationship seriously.
We feel like we're in a very special position because we actually try and encourage to build relationships with our patients. For us in the association, we stress and we emphasize patient advocacy and patient safety. That is always first and foremost with us. And we try to do things that encourage this. We do a lot of continuing education. So that is why, another reason why having an event like this, hosting an event where they'll be presenting on topics that are common and prevalent within our Caribbean region is very important to us.
Aaron Humes reporting for News 5.